those communities have a higher rate of infection than where you live. So the last thing you should want to do is drive to your second residence or a hotel or a cabin in the mountains. Trails are often narrow and people need to be at least 6 feet apart. But just as you wouldn't go out in a tornado or flood or hurricane, again, you need to focus on staying at home and see this as a challenge to see how fast Colorado can get through this and return to normalcy. You know what? Our mountains and canyons have been here for hundreds of thousands of years, and they're going to be here for hundreds of thousands of years. So wait until this blows over to enjoy them. This is not a vacation. We need to have patience. Stop putting yourself and others at risk. Of course, maintain your physical fitness and engage in that you need to in physical activity, but please be careful and judicious. I also know how important faith is at this time. I've had 2 calls with clergy leaders from across the state. I have another one this evening. And we also know that our houses of worship really function as community centers. And in a crisis, a war, a famine, a flood, we often value that fellowship that brings us together in our houses of worship. And as I've expressed to our faith leaders, and they're in full agreement, and many took actions well prior to any state actions, this is a different kind of crisis. A pandemic is one in which their fellowship of worship is needed more than ever before, but the very physical proximity that is the usual avenue for that fellowship is the very danger. And so they are thinking out of the box. Our priests, our rabbis, our leaders of all different denominations in our state are engaging in broadcasting worship services and offering telephonic services. This order very clearly allows places of worship to broadcast, to allow a camera person and a sound person. We are trying to keep those gatherings to 10 or less using electronic platforms. Our faith leaders are innovating every day. And last week I challenged them to innovate, and it's amazing to hear the inspiring stories from across the state about pastoral services, worship services, ways to engage in worship consistent with worship practices, but putting a new way of doing them on it that saves lives. I want to say why this is so important. Because people often gather in faith settings, that has actually been a primary vector for contagion in Korea and India. In Korea, through a particular denomination, one individual led to hundreds of cases. In India as well, which has an even more severe lockdown than our country does, and is a potential tinderbox with over 1 billion people, many of their cases stem from one pastor that then passed it along to hundreds, if not thousands of people. So as with everything, of course, our churches, our institutions of faith are more central than ever in a challenging time. And I encourage everybody to engage collectively. That means socially with friends. My son had a virtual play date with another 8-year-old today. It means, of course, participating in worship. And it means not going out unless you have to, and taking steps to ensure that our churches, our synagogues, our mosques, our temples are able to function in new and innovative ways electronically, and have the ability to have the limited gatherings that they need to further their important role in this crisis. It's also important to clarify that parents transporting children to comply with parenting plans is, of course, allowed. Those are not exempt. If you have shared custody, those need to continue. Fulfilling online orders, exempt. And, of course, administering our democracy itself. Elections, participating in election functions, those are critical government functions. We are not sacrificing our democratic republic for this virus or any virus, and all of these activities are allowed under the order. And this is really important. I also want to stress that even if your business qualifies as a critical business, you must comply with social distancing requirements at the workplace and allow employees to work from home as much as possible. So and again, if that means operating 2 or 3 shifts, if that means allowing 1/3 or 40% of workers to work from home, just because the business is critical doesn't mean that it's run the same way it was a week ago or a month ago. The more that we can do that, the faster that we can get through this crisis. I'm now going to begin sharing some of the information about this crisis that we are acting on here in our state with the hard data that we look at. This is only a summary, right? We have kind of gotten it to a level where we think it can be informative to the public without being distracting. But we look at so many data sources every day. I want to thank in particular Dr. John Samet, who has joined us today here in the audience. He's the Dean of the Colorado School of Public Health. I want to thank his entire team, who've worked very hard to put together this modeling data in partnership with the University of Colorado School of Medicine and the Colorado Department of Public Health. So first, we have an update on the number of cases in Colorado. This is the information that we release every day. Today, we now have 1,734 confirmed cases, 239 Coloradans hospitalized, 31 deaths, and over 11,000 people tested. Now, as we get into